Hello everyone, my name is Keisha Bell. I'm a registered nurse and I have been a nurse for 14 years in my field. I'm here to give you some information regarding stroke. African Americans are at the highest risk of developing stroke. Stroke is the third leading cause of death in the African American community. Many people die daily of stroke, and the ones that do survive usually have temporary or permanent disability. Let's talk about the risk factors of stroke. The number one risk factor of stroke is hypertension, a blood pressure of greater than 140/90. The second risk factor is obesity. 62% of African American men and 77% of African American women suffer from obesity. Smoking is another risk factor for stroke. There are two different types of stroke. There's ischemic stroke, which ischemia basically means blockage of blood flow. And then there's a hemorrhagic stroke, which, if you think of the word hemorrhage, it's a bleed in your brain, usually due to a blood vessel bursting. What causes an ischemic stroke is usually blood pressure being so high that it forcefully presses through the vessels in your body and it breaks off plaque. And that plaque travels around through your body until it gets lodged in one of the smaller vessels in your brain and it stops the blood flow beyond the clot. That causes damage to the tissue, the brain tissue, which causes the stroke. For a hemorrhagic stroke, the vessel is so weakened that it ends up bursting and it puts so much pressure in the brain and it occludes the oxygen flow to the rest of the tissue, which causes the stroke. Some information about transient ischemic attack, TIA, or also known as a mini stroke. The symptoms of a TIA are the exact same as a regular stroke. What happens with a TIA is the symptoms come and then they go so quick. What happens in the brain is that the clot comes through and it gets lodged for a moment, but then it is able to pass through. And the problem with that is that people don't get checked up with that. If you have noticed that you've had a TIA or a loved one had a TIA, go to your family physician. Actually, there are some measures you can take. With your knowledge and experience in healthy diet and exercise, can you share some information regarding cardiovascular health?
Hi Keisha, thank you so much. Exercise is definitely vital in the reduction or the prevention of heart disease, which includes high blood pressure, heart attack, and or stroke. Exercise has so many benefits, including the fact that it reduces your stress hormones, it can reduce inflammation, it opens up our arteries and allows blood to flow freely to our vital organs. Exercise is essential in assisting muscles in pulling oxygen out of the bloodstream, and exercise can actually be heart protective. So if you're getting ready to start your journey to prevent heart disease and you're using exercise, let me give you a few tips that will help you to win. The first is you want to make sure that you first talk to your doctor before beginning any type of exercise program. Number two is you want to consider exercising from a cardiovascular perspective at least 5 times a week for at least 30 minutes a day. And examples of aerobic exercise include walking, jogging, swimming, cycling, rollerblading. Those are type of aerobic exercises. You want to make sure that when you do the aerobic exercise that you combine it with at least 2 days of resistance training. And so resistance training includes using some type of weights. And so you're lifting weights, you're using your body weight, and you want to try to work the majority of your large muscle groups at least 2 days a week. Remember that exercise consistently will actually assist in losing weight. It will assist again in lowering inflammation, and it will actually help to increase your HDL. HDL is your healthy cholesterol, and LDL is your bad cholesterol. So here's an interesting tip. The higher your good cholesterol goes up, it actually decreases your low cholesterol. Another incentive for us to exercise to help keep that cholesterol down. And we know that excess cholesterol, which actually causes plaque in our arteries, can actually increase our risk of having a cardiovascular event. So remember and keep those tips in mind as you begin on your exercise journey. Back to you, Keisha.
Thank you so much. That was great information. When you think about signs and symptoms of stroke, I want you to remember the word FAST, F-A-S-T. So when you think of the word fast, the F for fast stands for facial droop. So if you notice someone has one-sided facial droop, that's a sign that they may be having a stroke. The A stands for arm. So if you notice that they're weaker on one arm, that's a sign that that person may be having a stroke. The S stands for slurred speech. So if you notice the person's speech is slurred, or even if they have a difficult time finding words, that's a sign they may be having a stroke. And that T stands for time. That means it is time to call 911. So if you see any of those symptoms, your job is to call 911 immediately, because the number one thing for stroke is early detection and early treatment. That is going to assist in somebody's full, complete recovery. I caution you to call 911. Do not attempt to drive your family member to the hospital. When you call 911, the emergency staff is able to provide treatment during the transport. And they also do another important thing. They notify the hospital ahead of time so that they know that this patient is coming with a possible stroke, and they have the team already there prepared to take care of your loved one. What you can do that is very, very important, you want to remember the time of onset of these symptoms, because that is going to help the healthcare providers in the direction that they want to go in the care of your loved one. When we talk about prevention, basically the risk factors, you want to prevent all of the risk factors. So you want to maintain a healthy blood pressure. You want to maintain a healthy weight. You want to quit smoking. Maintaining a healthy weight and blood pressure, and that can decrease your chances of having a stroke.
Yes, prevention of cardiovascular disease, nutrition plays a huge role in that. There are a few key items that you want to make sure that you consume on a regular basis to help lower your risk of cardiovascular disease and also lower your risk of obesity and high blood pressure. Okay, so according to the American Heart Association, we want to make sure that our diet consists of many plant-based items like fruits and vegetables. You want to also make sure you consume a moderate amount of beans, as well as nuts and other healthy fats such as avocados. You also want to make sure that you limit red meat and processed food, and instead consider fish such as salmon and herring actually have a wonderful benefit that they have omega-3 fatty acids, and omega-3 fatty acids are essential in helping to lower and reduce cholesterol. So again, nutrition and physical exercise together will help lower your risk of cardiovascular disease.
If you have any other questions, you can always go online to American Heart Association or stroke.org. Thank you so much for your time.